John, it's Melissa, the surgical patient navigator from Quinney Healthcare. It's nice to virtually see you again. I hope you're doing well and your pain has resolved. After some careful research and gathering information, I have found some important resources that will be able to help you to decipher what is credible on the internet. The internet is full of information, which is not always credible and correct information. It is very difficult for patients to look through all the information that's out there and know what to look for to ensure the right things are being understood. Let's briefly talk about health literacy. This term means assessing an individual's way of reading literature, being able to remember it and understand what it means, along with being able to apply it to real-life situations. Health literacy also means understanding your health issues and using resources and services to get the help that you may need. So to be able to use health literacy effectively, patients like yourself, John, need to be able to understand visual cues such as graphs, be able to use computers, be able to use critical thinking skills, and to use their understanding of information and apply it to their own health needs. It is also important that patients are able to understand what their healthcare provider is telling them and use the information to interpret advice and treatments, as well as being able to make decisions about their own health. Health literacy is an important set of skills to have as a patient because sometimes you're left to read information online to get more information on a certain medical issue. This is important to be able to read the information, understand it, interpret it, and apply it. This can be anything from medication prescription information, to brochures, to consent forms, to appointment notes. So now that you know some basics about health literacy, let's dive into what websites you can use for your specific diagnoses. To know which websites are trustworthy to use when researching, there's a tool that I use to ensure the websites I refer to are credible. This tool is called CRAAP. C is for currency, R, relevance, A, accuracy, A, authority, and P for purpose. To put this into perspective, let's use the type of cancer you were diagnosed with, which is called hepatocellular cholangiocarcinoma. A website that may be helpful to become more knowledgeable would be the National Cancer Institute. To use the tool for this website, the currency is last updated October 2020. The relevance is that this website answers our questions regarding cholangiocarcinoma. The accuracy and authority is supported by research about cancer, and the website is developed by the Physician Data Query Editorial Board. The purpose of this website is to inform healthcare professionals and patients about different types of cancers and the information that goes with each diagnosis. This website and the specific link I'll provide to you is packed full of information regarding all types of cancers that is easy to understand and has many videos available for different types of learners. There's a section for patients that is easy to read and a section for professionals which provides more in-depth information. A website for hepatitis B that I can provide to you for more information would be on the canada.ca website. This website is under the public health information for the general public. The website follows the CRAAP model. It was last updated in November 2019. It has all the information relevant to hepatitis B. It is accurate information and research put out by our government of Canada. The authority aspect is that our government is responsible for this information, and the purpose of this website is to provide Canadians with information regarding certain medical problems. These websites I have found for you about cholangiocarcinoma and hepatitis B are both credible websites that you will be able to provide information you need to understand the diagnoses. They give you an easy to read description of each issue and make it easy not only to understand, but also ease of applying it to your real life situations, such as symptoms you are experiencing or possible treatments you may have received or are going to be receiving. I hope this gave you some information on your current diagnoses and how to further research credible websites in the future. It was great to see you again, John. If you have any further questions, do not hesitate to send me an email and we can set up another Zoom call. Take care.